The human body can break in ways that make even experienced orthopedic surgeons wince, and some fractures are so devastating that they change your life forever. Let's start with the femur fracture, specifically a midshaft femoral fracture. Your femur is the longest, strongest bone in your body. It takes massive force to break it. Car accidents, falls from height, crushing injuries. When it breaks, it's catastrophic. The sharp bone ends can lacerate the femoral artery, causing life-threatening internal bleeding. Patients go into shock from blood loss. The muscle around the femur spasms violently, pulling the bone ends out of alignment. Treatment requires surgery with metal rods inserted down the center of the bone. Recovery takes months, and many people never regain full strength. Here's what makes femur fractures worse: fat embolism syndrome. Fat from the bone marrow enters the bloodstream and travels to the lungs and brain, causing respiratory distress, confusion, and potentially death. This happens in up to 10% of femur fractures. Now let's talk about pelvic fractures, because these are some of the deadliest breaks. Your pelvis is a ring of bone that protects major blood vessels, nerves, and organs. When it fractures, usually from motorcycle accidents or being crushed, those blood vessels tear. You can bleed to death internally. The mortality rate for severe pelvic fractures is 10 to 20%. Survivors often face permanent disability, chronic pain, nerve damage affecting bowel and bladder control, and sexual dysfunction. Here's the brutal reality. Treatment for unstable pelvic fractures involves external fixation, metal frames bolted directly into your bones to hold the pelvis together while it heals. You're immobilized for weeks or months. Let's talk about open fractures, specifically the tibia, your shin bone. An open fracture means the bone has broken through the skin. You can see bone sticking out of your leg. This isn't just a broken bone. It's contaminated with dirt, bacteria, and debris. The infection risk is massive. Treatment requires immediate surgery to clean the wound, remove dead tissue, and stabilize the bone. Even with aggressive treatment, infection rates are 5 to 30%. Some infections progress to osteomyelitis, bone infection, that can last years and require multiple surgeries. If you're learning about the worst injuries the human body can sustain, hit subscribe. We're breaking down medical trauma most people never want to experience. Now here's one that changes everything: cervical spine fracture. Break your neck, and you risk paralysis. C1 and C2 fractures, the top two vertebrae, can sever your spinal cord, leaving you unable to breathe on your own, paralyzed from the neck down, or dead. Christopher Reeve's injury was a C1 to C2 fracture. Lower cervical fractures can cause varying degrees of paralysis depending on which nerves are damaged. Treatment involves surgery to stabilize the spine, months in a halo brace, a metal frame literally screwed into your skull, and extensive rehabilitation. Many patients never walk again. Let's talk about calcaneus fractures, breaking your heel bone. This happens from falls where you land on your feet. The calcaneus shatters into multiple pieces. It's excruciatingly painful and almost always requires surgery with plates and screws. But here's the long-term problem. Even after healing, most people develop chronic pain, arthritis, and difficulty walking. Many can't return to jobs that require standing or walking. The heel is weight-bearing with every step, and a shattered calcaneus never heals perfectly. Here's one that sounds minor, but destroys lives: scaphoid fracture. It's a small bone in your wrist. People fall on an outstretched hand, feel pain, think it's a sprain, and don't get treatment. But scaphoid fractures have terrible blood supply. If untreated, the bone dies. A vascular necrosis. Your wrist develops severe arthritis, loses range of motion, and causes chronic pain. You might need wrist fusion surgery that permanently limits movement, all from a minor wrist injury that went untreated. Now let's talk about skull fractures, specifically basilar skull fractures, breaks at the base of the skull. These happen in severe head trauma. Signs include bruising behind the ears, bruising around the eyes, and cerebrospinal fluid leaking from the nose or ears. These fractures can damage cranial nerves, causing blindness, deafness, facial paralysis, or loss of smell. They can tear blood vessels, causing life-threatening bleeding. And they create a pathway for bacteria to reach the brain, causing meningitis. Here's a fracture that's horrifying. Mandible fracture combined with maxilla fracture, breaking both your upper and lower jaw. Your airway can collapse because the bones supporting it are broken. Your teeth don't align anymore. You can't eat, speak clearly, or breathe properly. Treatment involves wiring your jaws shut for weeks while bones heal. You're on a liquid diet. You can't open your mouth. And if you vomit, you risk aspiration because you can't open your jaw. Let's talk about acetabular fractures, breaking the hip socket. This is the ball and socket joint where your femur meets your pelvis. When this socket fractures, the ball of your femur has nowhere to sit. It's unstable, painful, and almost always requires complex surgery. Even with perfect surgical repair, most people develop arthritis within years and need hip replacement. Young people who break their acetabulum often face multiple hip surgeries throughout their life. If this is showing you how devastating bone breaks can be, make sure you're subscribed. We're revealing medical realities that change how you see injuries. Now here's one that ends careers. Lisfranc fracture. It's a break in the midfoot where the metatarsal bones connect to the smaller bones. It happens in car accidents when your foot is jammed against the floorboard or in athletes who twist awkwardly. This fracture destroys the arch of your foot. Even with surgery, most people develop arthritis, chronic pain, and lose the ability to run or walk long distances. Athletes rarely return to their sport at the same level. Here's the fracture that makes orthopedic surgeons cringe. Comminuted fractures. The bone doesn't break in one place. It shatters into multiple fragments. Imagine dropping a dinner plate and it breaks into 10 pieces. That's your bone. Surgical repair is like a puzzle, trying to reconstruct the bone with plates, screws, and sometimes bone grafts. Healing is slow and often incomplete. The more pieces, the worse the outcome. Let's talk about why some fractures are worse than others. It's not just about which bone breaks. It's about the fracture pattern, the amount of displacement, whether it's open or closed, damage to surrounding tissues, and blood supply to the bone. A simple, non-displaced fracture of a well-vascularized bone heals quickly. A comminuted, displaced, open fracture of a poorly vascularized bone is a nightmare that might never heal properly. Here's what nobody tells you about bad fractures: the long-term consequences. Chronic pain is common. Arthritis develops at the fracture site and adjacent joints. Loss of range of motion. Nerve damage causing numbness, tingling, or weakness. Leg length discrepancies if a long bone heals shortened. Psychological trauma from the injury and multiple surgeries. Many people never return to their pre-injury level of function. The worst breaks aren't just about immediate pain. They're about how they permanently alter your body, your capabilities, and your life. Some fractures heal with minimal consequences. But the worst ones? They're injuries you live with forever, managing pain, disability, and the knowledge that your body will never be the same.